By this time tomorrow, 20 people in America who are alive right now will be dead. Not because they were in a car wreck, not because they experienced a heart attack, or not because they were gunned down. Simply because they couldn't be given a life-saving transplant in time. 20 people will die waiting on an organ transplant. More people need to be organ donors. I've done extensive research in numerous journals and articles about organ donation, and I also have a friend whose life was saved because of a generous organ donor. The U.S. should have put new rules to increase the number of organ donors. First, I will explain why we need more organ donors in the United States. Second, I will explain what kind of new rules we should implement to increase organ donation. And last, I'll explain how the solutions will improve and save lives of people all over our country. First, people are dying every day because of the lack of organ donors in the United States. The list of people continues to grow on the waiting list. About 10 people are added each day, and a little over 113,000 men, women, and children are currently on the waiting list. Last year, 36,528 people had organ transplants last year in the United States. There are not enough people registered to be organ donors. From the U.S. Department of Human and Health Services Administration, they report that 95% of U.S. adults support organ donation, but only 58% are actually registered to be organ donors. Only 3 in 1,000 people die in a way that allows for organ donation. After first showing you the problem, second, I'll describe my proposed solution. This problem could be solved by an opt-out solution, an incentive such as a priority rule, and by making everyone more informed on the topic. So first, the change from an opt-in system to an opt-out system. So right now in America, we have an opt-in system where you're not an organ donor unless you register to become one. An opt-out system would change it to be that everyone is an organ donor unless you say otherwise. Numerous European countries have successfully implemented this opt-out system, and there has been an increase in organ donation rates. In Austria, rates more than doubled from 4.6 to 10.1 million people per year. In Belgium, kidney retrievals went up from 18.9 to 41.3 million people per year, and in Singapore, after 3 years, donor numbers went up from 4.7 to 31.3 million people per year. Second, a priority rule could incentivize people to be organ donors. So basically, a priority rule would make it so that if you were registered to be an organ donor, you would be priority on the waiting list if you did need an organ transplant sometime in your life. In 1987, Singapore passed the Human Organ Transplant Act, which basically combined that opt-out system with the priority rule. And so if a person objects to donating their organs upon death, they give up priority for receiving an organ should they need one in the future. The opt-out with the priority system provides a dual incentive for donation, avoiding the cost of opting out and receiving priority on the waiting list. So with this, you receive something in return. We all know that people love giving to something if they know they will benefit from it or get something back. And last, there needs to be a broader effort of increasing awareness about organ donation. The reality is, education around organ donation will never end. There is room for improvement at every level, says Jennifer Milton, Executive Director at University Transplant Center in Texas. In an article, her and some of her colleagues talked about how we can increase awareness about organ donation by having end-of-life discussions before we're in end-of-life situations. She said that a lot of the conversations just come too late when people are just don't know what to do and in tough situations. And so she said that just updating end-of-life care and organ donation policies in hospitals and just having more conversations would create a culture of donation within hospitals. They also mentioned that a lot of the healthcare staff in hospitals that aren't directly involved with organ transplant are often uneducated and not aware of the organ donation process. Now that I've first shown you the problem and second shown you my proposed solution, last I'll help you visualize how these solutions could help our community. These solutions will improve and change lives of people in our communities. It's giving more people a second chance at life. Usually the only option for these people who need organ transplants, like the transplants are the only option. Usually they have like heart disease, kidney failure, liver failure, and once these major organs fail, there's really no other option but to get a new one. It's downhill from there unless they receive a healthy one, and it's also just a matter of time before they run out of time. You cannot go long without a failing liver or heart. I'm constantly astounded by the selfless generosity of donor families, says Dr. Diane Alonzo, medical director of the transplant service at Intermountain Healthcare in Utah. As a transplant surgeon, she said she's witnessed patients literally rescued from the jaws of death because they received an organ donation. Also, organ donation affects more than just the recipient. Families, friends, colleagues, and acquaintances of the patient who love and support them and benefit from the renewed life and improved health are also affected. And not just after they receive the transplant, but just during the whole process. It can be stressful, and they're all a part of that too. Kenneth, an MD and surgeon, talked about how organ donation affected his life. His wife died and he kind of had a different perspective. His wife died in a car accident, and they had to decide whether or not to donate her organs, and he definitely was for it because he knows how important these organs are and how much it can change a life. And he said, while it did not lessen the pain of her loss, it brought comfort to us knowing that out of our tragedy some good would come, and others could receive the gift of life. Another option is live organ donation. Donation after death isn't the only option. You don't technically need all of your organs to live, and there's some cool stories connecting friends and strangers with that. My mom told me that one of her friends, or two of her friends in college, donated a kidney to each other, and it just brought them super close and their families close, and it was just a cool story. And last, you have the opportunity to save more than just one life. One deceased donor can save 8 different lives. You have your heart, 2 lungs, liver, pancreas, 2 kidneys, and your intestines. And the big thing about this is that you have to match with someone. So just because you have the right organ for the next person on the waiting list doesn't mean it's going to match and work out, because you do have to match. And so that's why it's important we have a variety of different people registered and a lot of different people registered. And you're more likely to be able to donate your organs after you die than not. Today I've explained the need for more organ donors. You should know about how many people are in need of organ transplants. You should know about the opt-out solution priority rule and the importance of organ donation, education, and awareness. And last, I've shown you how organ donation really can make a difference and save lives. If you're not an organ donor when you die, you're taking a lot of people with you. All of you should register to be an organ donor. It's easy and simple to get registered, and you will make a world's difference in another person's life.